Thank you for joining us today. My name is Carolyn Sherritt. I'm the Associate Director of Development here in the Twin Cities. And I am very excited about our call today, highlighting the important work that American Cancer Society and American Cancer Society Cancer Action Network is doing in the diversity, equity, and inclusion space. We have some great speakers that are joining us today. Our first up will be Anthony Bass. He is our Senior Executive Director here in Minnesota. And we will also be joined by Tawana Thomas Johnson, who is the ACS Senior Vice President and Chief Diversity Officer, and Ellie Daniels, who is our ACS Interim Senior Vice President, Extramural Discovery Science, and Lance Barbour, who is our ACS CAN Senior State and Local Campaigns Manager. Now I'm going to introduce Anthony, who will come on and talk about the important work that we're doing here as an introduction. Anthony brings years of leadership and experiences from the private and nonprofit sector. Previously, Anthony served as the corporate relationship officer at the Greater Twin Cities United Way and has been an active teacher and pastor in the Twin Cities communities. He is passionate about building and fostering community, addressing the challenges our communities face today, and leading the society's work to save more lives from cancer. Anthony is a former Minnesota Viking and lives in Brooklyn Park with his wife and 7 children. Welcome, Anthony.
Thank you, Carolyn. I want to thank everyone today for joining us. I think this will be a special hour-long edition of our ACS Minnesota Monthly because of the prominent guests and the relevant topics we have for our community. So with that being said, first, I'd like to just go through some introductions of our great speakers today. So first, Tawana Thomas Johnson, who's been named Senior Vice President and Chief Diversity Officer, will now serve on the American Cancer Society executive team. Since joining the American Cancer Society in 2006 as Director of Health Disparities for the former South Atlantic Division, Tawana has led the development of outreach tools, programs, and resources to increase awareness of the unequal burden of cancer in diverse communities, resulting in significant increase of diverse constituents utilizing our organization's program and services. Among these tools is the More Than Conquerors documentary, which features testimonies and interviews with cancer survivors, caregivers, physicians, and renowned clergy. Tawana has served as executive producer for the documentary, which received national acclaim and premiered at the National Black Film Festival. She has successfully led the American Cancer Society increasing workforce diversity at all levels of the organization, addressing pay parity and significantly improving employee engagement around diversity and inclusion. Under her leadership, ACS also joined the CEO Action for Diversity and Inclusion movement, which brings together more than 1,600 organizations committed to driving diversity and inclusion within their own organization. Tawana's ongoing role also includes engaging corporate executives, high-level donors, and leadership volunteers in furthering the fight against cancer through revenue generation and mission engagement. Our next speaker will be Lance Barbour. Lance earned his undergraduate degrees in biology and psychology from Virginia Tech. He then later pursued a master's in public health with a concentration in health promotion. While studying for his master's degree in public health, he worked as a psychiatric counselor for children and adolescents in Baltimore, Maryland. During this time, he also served as an intern for the American Cancer Society Cancer Action Network, assisting the Maryland and Washington, D.C. advocacy teams. He and his wife moved from Baltimore to Maryland to Lake Charles, Louisiana, where he served as marketing director for the Vein Center of Southwest Louisiana. Passionate about health and reducing cancer burdens of Louisiana, Lance found his way back to ACS CAN and served as the grassroots manager for the state of Louisiana for the American Cancer Society Cancer Action Network from 2016 to 2017. He then served in a new role as a Louisiana Government Relations Director from 2017 to 2019. And since 2019, Lance has served as the senior state and local campaign manager for ACS CAN, where he has helped to support state teams working to pass legislation in cancer prevention and access to care issues. Lance currently provides states guidance in several areas related to access to care, colorectal cancer, prostate cancer, state comprehensive cancer control programs, and cancer registries, and is the point person for health equity issue. He also serves as a member of ACS CAN's Medicaid Covers Us team. Lance lives in Baton Rouge, Louisiana, with his wife Courtney and his 2 children. Our final speaker will be Dr. Ellie Daniels. Dr. Daniels is a Senior Scientific Director for Clinical and Cancer Control Research at the American Cancer Society Global Headquarters. In this role, she oversees research program development, pre-application management, peer review, and grant management in the areas of cancer prevention, screening, and early detection, access to care, cancer treatment, palliative care, and survivorship. Research renewed in her program includes psychosocial and behavioral research, implementation and dissemination science, community-based participatory and practice-based research, clinical trials, and health equity research. Dr. Daniels is a family physician who completed medical school at Wayne State University and residency training at Eastern Virginia Medical School, Get Family Practice. She later completed a clinical research fellowship at the Medical University of South Carolina and Masters of Public Health at Emory University Rollins School of Public Health. Dr. Daniels is a former federally qualified healthcare medical director and women's wellness center director. During her tenure at the Morehouse School of Medicine, Dr. Daniels was research director for the Southeastern Regional Clinicians Network Practice-Based Research Network, co-leader for the Research Training and Career Development Core of Morehouse School of Medicine, Tuskegee University, University of Alabama, Birmingham Cancer Partnership, and lead mentor for medical student learning communities. So to our speakers, we are honored to have you today. To our guest, thank you for joining. Cancer, and this is my part, cancer is a disease that affects everyone, but it doesn't affect everyone equally. The American Cancer Society's mission is to save lives, celebrate lives, and lead the world in the fight against cancer regardless of race. Ensuring everyone has an equal opportunity to live a healthy life, prevent cancer, find it early, and receive high-quality treatment and support when they need it is the foundation of our work. While we have made significant progress in the fight against cancer, significant disparities in cancer incidence and mortality rates still exist across diverse populations. And so the American Cancer Society is helping to address health disparities in a couple of areas. So number one, research. Currently, we've invested over $50 million in research grants focusing on cancer disparities and health equities. Also, prevention and partnerships. And so we partner with organizations like the Robert Wood Johnson Foundation to pilot community projects to explore, research, implement community-driven solutions to address social determinants of health. Also, access to care and early detection. And so we partner with the NFL to support fund change grants at federally qualified health centers across the country to provide access to breast cancer screening, timely follow-up of abnormal mammograms, and timely access to specialty care as needed for patients who receive healthcare regardless of insurance. And lastly, advocacy. The American Cancer Society Cancer Action Network is our advocacy affiliate that works with our local and state federal officials to secure funding for cancer research, ensure all Americans have access to cancer care, and support public health legislation that reduces cancer risk and improves cancer care for all Americans. And that's just some of the work we've been doing currently here at the American Cancer Society. And so now, as we dig deeper, I want to transition to our first speaker, which will be Tawana Thomas Johnson. Tawana, please take it away.
Hello, everyone. Thank you so much, Anthony. Thanks to you and your team, your volunteers, and to everyone on the call for your interest in and support of the ACS becoming a more diverse, equitable, and inclusive organization. As Anthony has shared, I have the privilege of leading our DEI efforts, but in reality, it is really all of us that contribute to making the society an organization that better reflects the communities we serve and creating an organizational culture for both staff and volunteers where everyone feels respected, everyone feels valued, everyone is treated fairly, and everyone sees themselves in our mission. So thank you so much for your interest in this topic and for the work that you all are doing in Minnesota. We have made great strides in our diversity, equity, and inclusion work, and I'm very proud of the work that we've done as an organization. But the reality is there's much more for us to do. I think over the last year or so, many of us have been engaged in conversations related to diversity, equity, and inclusion and systemic racism, conversations that are much different than conversations that we had in previous years. And I am very pleased that the ACS, prior to the events of last summer, that we had already been having some of those conversations in the organization, and we had already built a really strong foundation upon which to advance our diversity, equity, and inclusion work. So the slide that you all see here really speaks to the vision that we have for our work with diverse and multicultural communities, constituents, staff, and volunteers. We do have a core value around diversity. That core value has been in place for several years. And so again, this is something for us as an organization that we have been very intentional about for the last several years. And I'm so excited that under our new CEO's leadership, we are accelerating our efforts in ways that I think are very important to the integration of DEI into everything that we do as an organization. Next slide, please. So I'm not going to spend a lot of time getting into, the specifics of what we've been doing over the last several years in diversity, equity, and inclusion, because I really want to give my colleagues, Lance and Ellie, Dr. Ellie Daniels, time to really drill down into some of the programmatic work that they're responsible for. But at a high level, what I will say is that for us as an organization, for the last 3 years, we have had an enterprise diversity, equity, and inclusion plan, which means that this work is something that all of our staff across the organization have a role in. It is not something that is just lifted up and implemented by our team. It is something that we all contribute to across the organization. One of the things that we did in addition to the development and the launch of the Diversity, Equity, and Inclusion Enterprise Plan was to join the CEO Action for Diversity and Inclusion, which is a coalition of more than 1,600 organizations that are all committed to better increasing their efforts around DEI, both within their organizations and within the communities they serve. We have been very fortunate to work very closely with the CEO of PricewaterhouseCoopers, and they are the organization that leads this coalition. In fact, one of their executives serves on the ACS National Board. And so for us as an organization, we have really benefited from being able to brainstorm and share best practices with organizations across the country as we undertake what we all know is very significant and important work as we become an organization that is relevant to all communities touched by cancer. Next slide, please. So here are the goals. I mentioned that we have a diversity, equity, and inclusion plan. These are the goals, and these are the goals that for us, really make the most sense. When we talk about diversity, equity, and inclusion, we're talking about it from the perspective of workforce, both staff and volunteers. We're talking about it from the perspective of cancer control, who are the communities and the constituents and the patients and caregivers that we're touching. We're also talking about the ways in which we are generating and engaging with communities and constituents to help support our mission as an organization. And while the tactics under these goals may change from year to year, certainly at a high level, these goals are the ones that we as an organization have committed to. Right now, the organization is actually undergoing a strategic planning process under the leadership of our new CEO. And what we will see as a result of that process is that these goals will be directly integrated into the enterprise strategic plan. And so we're really excited to see this moment in time where the integration is happening because it's something that we've been talking about for a long time. We believe that it is something that DEI is something that has to be embedded into the organization. It's not something that we do as an add-on. And so the integration of these goals into the strategic plan will certainly make a difference in terms of the impact that we're able to have both within the organization and outside the organization. Next slide, please. So I just want to share with you before I turn it over to Lance and Ellie, I want to share with you some of the impact that we have been able to have over the last couple of years. And this infographic will give you a sense of some of the things that we've been doing in partnership with diverse organizations, some of the things that we've been doing in terms of workforce diversity, some of the things that we've been doing around learning and development, right? Again, as I shared earlier, this is a conversation that many of us are having in very new and different ways. But at the ACS back in 2018, we committed as an organization to requiring that all of our staff would undergo diversity, equity, and inclusion training. And so in 2018, we took the entire organization through diversity, equity, and inclusion training. It was about 3 hours of training, and managers did an additional hour and a half of training. We had a very high completion rate. We had lots of interest in additional training. And in fact, we're going to be rolling out this year racial equity and inclusion training that the entire organization will go through as well. We also saw from 2017 to 2019 a significant increase in workforce diversity. In fact, we saw a 17% increase, which is, if you're someone that looks at the data and really understands, what diversity, equity, and inclusion looks like at organizations, whether we're talking nonprofit organizations or for-profit, a 17% increase in our overall diversity of our staff is a pretty significant increase to occur within an 18-month period. And so we're very proud of the fact that not only did our talent attraction team do the heavy lifting and do the work to ensure that we had diverse candidate slates, but our hiring managers, right? Our hiring managers were really committed to ensuring that their teams were becoming more diverse. And so again, it's a lift that's happening across the organization. One of the things that we're also proud of in the workforce space is that we've seen an increase in manager leader diversity. Still a long way to go, but we have seen a significant increase, and it continues to, we continue to see an uptick each year with our manager leader diversity. We work with a number of diverse partners, national organizations, both serving the Hispanic community, the LGBTQ community, and also the African American community. And those organizations support us through mission work that we do, whether it's community engagement around prevention and early detection, or whether it's something around mission support with Relay for Life and making strides against breast cancer. So we're very, very grateful to our partners that are supporting the work that we do as an organization. One of the things that we did in response to the social justice issues that we saw last summer was to convene a roundtable of African American national organizations to guide us and to provide advice to us and direction to us as we attempted to better engage the African American community. And so we've got about 14 organizations, national organizations, that are sitting on that roundtable. And in fact, they are still providing guidance to our executive team, and we're grateful for their ongoing support. As an organization, we have been deeply committed to working with the LGBTQ community. We have done Pride events all across the country. And for us, Pride is more than just an event, right? Pride has to be all year round. We look at ways to leverage the relationships and the outreach that happens as a result of Pride to better engage LGBTQ populations in markets that we're working in across the organization. So there's a lot of work that happens in the outreach and education space. When it comes to supporting our staff within the organization, we have several employee engagement groups that are supporting not only their members in terms of providing a place for networking and the exchange of ideas and best practices, we are actually tapping into our employee engagement groups to help us better understand from an external perspective what we need to do differently in order to effectively engage with diverse populations. So there's a ton of work that's happening. Our work is cross-cutting. We work with, Ellie Daniels is on the call. She's going to talk about some of the work that we're doing in the cancer research space. We work with Ellie and her team. We work with our corporate relations team to secure funding for work that is advancing health equity and helping us to better engage diverse populations. So there's just so much. It's an exciting time for the organization as we continue to accelerate our efforts. So I look forward to having ongoing conversation and dialogue with you all in Minnesota. Minnesota, there's a lot that's happening there, and I know that you all are engaged locally with efforts around diversity, equity, and inclusion, and so we're really excited to partner and to support in any way that we can. So with that, Anthony, I'm going to turn it back to you.
Thank you, Tawana. I appreciate it. And now we're going to transition to our next speaker. At this time, we're going to transition to Dr. Daniels.
Good afternoon, everybody. I'm going to provide an overview of our cancer health equity research that we fund externally. That's called extramural research. Next slide. Okay. So health equity research isn't new to us. We were one of the first funders to actually invest in health equity research. And you'll see that on the next slide. We've been in the business since, next slide, since 1999. We funded over $3 million in health equity focused research. Last year, our budget was hit quite significantly. We had, actually, our budget was wiped out for half of the year. But it really gave us time to think about what we were doing and what we might do differently going forward, especially with our new diversity, equity, and inclusion goals and all that happened in 2020. So you'll hear about some of our new initiatives. Next slide. So we started a program, Diversity in Cancer Research, and this program is really to increase diversity in the cancer research field. And so we've got a multi-pronged approach. These are complex issues that require multifaceted solutions. So I'm just going to go through each of the initiatives for you so you can understand how we're planning to increase workforce diversity and advance health equity research. Next. So if you don't know, there's a lack of diversity in biomedical sciences, and a lot of national reports that indicate that. And in terms of race and ethnicity, African Americans, American Indians, and Alaskan Natives, Hispanics, Native Hawaiians, and other Pacific Islanders are considered underrepresented in science, meaning that the percentages are quite low, like 2%, some 1% with Native Americans. So there's been a lot of national publications about what could we do. Even, you know, at ACS, we aren't seeing as many applicants applying, underrepresented minorities applying. That's because of the pool. There's a low pool. So what can we do to increase the pool of eligible applicants? Next slide. So one way we're doing this is we're starting off with college students. So we have a grant mechanism called institutional research grants. And these are block grants that we give to institutions who have established cancer research program, senior investigators, students, faculty. So we give those grants out and they have that established infrastructure. So we decided, why not build on that existing infrastructure and add a supplement to these grants for underrepresented minority college students. So we're pilot testing it this summer. The IRGs, we call them, the institutional research grantees, we call IRGs. 8 of them expressed interest. We approved all for funding. And so we have 32 students who are participating in a 10-week intense summer cancer research experience with cancer investigators. And they're also each institution has planned year-long career development and networking opportunities for the students. The students are paid a stipend of $5,000, and the institution gets a $2,000 allowance to enhance the program in, whatever way they need to. It may go for transportation for students or participating in workshops that might be outside an institution, whatever they think is beneficial for the students. Next slide. So here are the 8 schools that are participating this summer. Next. And so we're going to have another round of applications in October, and we plan that going forward, we'll train 100 students per year for over 10 years. And, we anticipate that this is going to generate about 800 to 900 students that will have had a cancer research experience and hopefully go into cancer research or even cancer care, research or medical care. Next. So next I'm going to talk about the institutional development grants, and these grants are really designed to build the research and cancer career development capacity at minority serving institutions. And so the next slide I'm going to show you is just an overview. So this is a block grant to the institutions that are funded so they can develop their own grant program, form a recruitment committee and a selection committee that selects their faculty who will receive research subawards. So they'll be able to offer pilot grants awards, which are seed funds to get the necessary preliminary data that investigators need for a larger study. They'll be able to fund at least 2 early clinician scientists, and these folks will have protected time for research, while they're also doing their clinical work. They have a mentoring team and a training plan. And then our postdoctoral fellows, who are new doctoral level faculty who need mentoring and training. And then there's support for master's level students, Master of Public Health or Master in Science. Next slide. So any of the investigators supported by ACS will be able to collaborate with us if they want to work with our intramural scientists on our cancer prevention studies or some of the data we already house in ACS. We're providing additional support to all the institutions funded. We fund clinical research professors and research professors, which are esteemed investigators who've made a seminal contribution to their field. And we're pairing one of each with each of the schools to provide institutional mentoring. And then we're going to have lots of meetings with the schools so we can problem solve, learn, regular check-ins of progress, et cetera. And we'll have a lot to say about what's going on when we're asked. Next slide. So here are the schools that we supported this year. They're the 4 HBCU medical schools, and we're developing plans to grow the program so we can offer another round of funding and expand the pool of minority serving institutions that could apply. Next. So our last newest initiative is a new health equity RFA to develop cancer health equity centers at minority serving institutions. So this is really one of those, the applicants are very appreciative. it's one of those pie in the sky moments. You know, you've got a good idea about how to address a problem in your community, a cancer health disparity, and it's an opportunity to bring your institution and your partners together and figure out a way to solve that. So this is focused on the social determinants of health. And so they'll have to not only select the cancer health equity topic they're interested in, but what are the drivers of that health disparities in terms of the social determinants of health? And then how will they engage the community to solve that? Next. So we're expecting that they've got at least 30% of their research participants who are from racial and ethnic minorities or live in rural underserved areas. And this percentage is the federal benchmark for over sampling folks in research in terms of race, ethnicity, rural, or medically underserved. I get asked that a lot, so hopefully that'll answer questions people might have. We're also requiring that they have a community board, that they collaborate with the ACS region, and the budget is $4.08 million, and this is for both the activities they're going to plan for the center and the research subawards. So, and this is research subawards as well. So we received 10 letters of intent and we invited all of them to apply. We anticipate getting their applications early September, and we'll be able to fund 4. Again, we're working on plans to raise additional funds so we can grow this program and offer another round of funding. Next. So at the end of the day, we hope that this will really provide relevant, tangible, evidence-based solutions to advance health equity and be the building blocks for a center to advance diversity, inclusion, and health equity. And I think that's my last slide. Yes. So with that, I'll turn it over to Lance.
Thank you, Dr. Daniels, and thanks, Anthony and the Minnesota team for having us here today. Today, I'm going to hit on several key areas that ACS CAN is working to address health equity across the country through policy interventions at both the federal and the state and local levels. We'll highlight some of the ways the Minnesota team is working right there within the state and within communities to address health equity in key areas. We can go to the next slide. So the 3 areas that we'll be focusing on today are sort of the buckets that ACS CAN works in, which is access to care, tobacco control, and accelerating cures. ACS CAN has been working to address health equity for years through various policy interventions. We are just adjusting the way that we, the way that we talk about it, and to shed more light on the work that we have been doing in this area. Much of the decisions regarding cancer and cancer patients aren't made in the doctor's offices, but rather made through the legislative process. I'll probably be throwing a lot of information at you all today, but what I like to tell people when I give talks like this is just to take 1 or 2 things that you are passionate about and share that within your network and come join us in the work that we're doing. If you have any questions or want to get involved in anything in particular, I highly recommend that you reach out to our ACS CAN team members in Minnesota, Emily Myatt, who serves as our government relations director, and Britta Babel, who is our grassroots manager, and they can give you the latest updates on what we're working on within our communities. Next slide. So we are working to enact measures that help make health insurance coverage more affordable and accessible for all people. We know that people of color are more likely to be uninsured with limited access to care, and people without insurance are more likely to be diagnosed with cancer at later stages when the prognosis is not as good and treatment costs are much higher. Greater access to affordable health insurance coverage helps to ensure greater health equity. At the state level, we are currently working to expand Medicaid in 12 states that have yet to expand. And this is to just help more people afford health insurance coverage. We like to talk about the Medicaid program as a health insurance program. We know that the pandemic has added to the burden of obtaining health insurance or retaining health insurance. And so the Medicaid program has proved to be more vital than ever before, as individuals have unfortunately lost employee-sponsored health insurance, and they aren't able to continue to receive the care that they need in order to get the treatment that they need. So we're certainly making sure that the Medicaid program stays intact. And we're also defending states that have expanded their Medicaid program, and we're defending the traditional programs as well to ensure that they are protected from any cuts that put these critical programs at risk, which in the end put cancer patients and survivors at risk. We don't want to just expand or defend the Medicaid program, but our advocacy in this space also focuses on strengthening the program. This is a critical program that services 2.3 million individuals with a history of cancer across, able to access comprehensive and affordable cancer treatment and care. Right here in Minnesota, in partnership with the American Indian Cancer Foundation, we were able to pass legislation to ensure that American Indian women diagnosed with breast or cervical cancer can access the Medicaid for the treatment that they need. We want to make sure that all individuals have access to critical cancer screenings that are accessible and also barrier-free. You can go to the next slide. Now we'll shift gears and talk about the next area that we work in, which is the tobacco control space. Tobacco use and exposure to secondhand smoke is responsible for around 480,000 deaths per year in the United States, and this includes 30% of all cancer deaths. Although tobacco-related cancer incidence and mortality have declined in the United States, we continue to see disparities based on socioeconomic status, race and ethnicity, education level, gender, sexual orientation, and geographic location. Our ability to continue to make progress against cancer relies heavily on eliminating inequities that exist in cancer prevention and care, and this includes tobacco policies. We know that decades of the tobacco industry's documents show that they have continuously and deliberately targeted certain groups, such as African Americans and members of the LGBTQ community, with specific products such as menthol cigarettes. We're working at the state level to make sure that we end the sale of all flavored commercial tobacco products. ACS CAN in Minnesota has partnered with various partners throughout the state and testified on legislation to end the sale of all flavored tobacco products in Minnesota. We've had a lot of great success, I would say, on the House side in getting a bill heard to end the sale of all commercial flavored tobacco products, and we'll continue this effort in 2022. So please, if you're interested, please connect with us. We would love to have you as a part of the team. In addition to our flavored tobacco control policy, we are also working to address systemic racism and enforcement of tobacco control laws by advocating that those enforcing these laws be entrusted public health officials and non-police officers. We want to make sure that the retailers who are profiting from selling these products are the ones being held accountable. We often know that that retailers will oftentimes default the blame onto the clerk, and basically that clerk will go and lose their job, but then they just continue to profit off the sale and continue to do what they're doing. So we want to make sure that they're being held accountable for their store's actions and for their employees' actions as well. We also advocate for adequate funding for evidence-based tobacco control prevention and cessation state programs. Right here in Minnesota, we were able to secure $4 million a year in new funding for commercial tobacco control prevention and treatment programs. This funding will be used to prevent youth tobacco use. It will also be used to help adults who currently use tobacco products quit and work to address tobacco-related health disparities. Next slide. And much like Anthony said at the beginning of our presentation here today, cancer is a disease that affects everyone, but we know it doesn't affect everyone equally. A close look at cancer incidence and mortality statistics reveal that certain racial and ethnic groups are more likely than the general population to suffer disproportionately from cancer and its associated effects, including premature death. There have been some recent evidence of progress against cancer health disparities, including reductions in lung and prostate cancer deaths among African American men over the past decade, but this progress has come too slowly, and the cost of disparities in terms of premature death and loss of productivity remains substantial. We need more funding for research to generate a new understanding of the underlying causes of cancer disparities and to develop treatments that can be used to improve the survival and quality of life of all cancer patients. We know that we need policy changes that also ensure equity in data collection. Some of the ways we have worked to accomplish this is to modernize public health data systems to include race and ethnicity data, as well as sexual orientation and gender identity information. We have had several states pass a policy similar to this, and this type of policy has been very successful over the past legislative cycle. We want to also make sure that this data is also being collected into cancer registries so that we can adequately see where the disparities exist and be able to appropriately address them as well. Minnesota was one of the first states in the country to declare racism as a public health issue, and doing a deeper dive into that data associated with the health disparities that we see. And we know that as well with clinical trials, that they aren't as diverse as they should be. And there are many barriers that minorities face when being made aware of clinical trials or just accessing them and participating in them. The Minnesota team in 2020 launched a Cancer Votes campaign, which focused on connecting with 2 congressional candidates on cancer research, the diversity in clinical trials, and patient protections. And this helped to generate a conversation around the importance of these issues. The team also supported legislation ensuring coverage for routine care costs for Medicaid recipients enrolled in clinical trials. This was prior to the federal action, and this actually went into effect back in August of 2020. We believe that all cancer patients should be able to access innovative cancer care and treatments, regardless of their insurance status or income. There will be a more robust discussion around health disparities and health equity for our 2021 ACS CAN Research and Innovation Forum in Minnesota, and that will be focused, like I said, on health equity in cancer prevention, treatment, and research. If you're interested in learning more about that event, I believe the team is going to drop a link in the chat for you all to go ahead and sign up, and you can RSVP to be a part of that event. And as I stated earlier, to learn more about our initiatives that are happening right there in your community in Minnesota, please reach out to Emily and Britta, and they will get you connected. And we'll love to have your voice in this fight. The more stories we have, the more power we have to raise our voice to get issues moving in the policy arena. I'm one to always say that, oftentimes we can throw numbers, we can throw statistics, we can throw data at legislators all day long. They see the data, they understand the numbers, but until you can put a face with that number and truly understand the impact that cancer has on someone's lives, it's really hard to move that needle. So we welcome any and all individuals to definitely join us in our fight through the legislative process in Minnesota. And with that, Anthony, I will turn it back over to you.
Well, thank you, everyone. Now we're going to transition to a time of Q&A. And so if you want to put any questions into the chat, and that'd be helpful for us so we can kind of moderate those questions. And as you're doing that, I'm just going to ask just a simple question. I'm sure probably most people know it, but I think it'll be helpful just to start conversation. So can one of our panelists address, what are equity issues or health equity issues? particularly in the cancer space, and how are those issues distinct from other health equity issues that are out there?
So I'm happy to jump in, and I'm sure that Lance and Ellie have insights that they might offer as well. I think, one of the things I mentioned earlier that we have been meeting with a roundtable of the presidents of national Black organizations. And in so meeting with them, we've had a lot of conversation around what the needs of the African American community are as it relates to cancer risk reduction. And one of the things that has certainly bubbled to the top, I mean, we can talk about the social determinants of health, of course, but one of the things that all of the presidents agreed that was really important and a pressing need in their organizations and the communities they serve was around information, right? Information and education, right? So there is the sense that within the African American community, one of the reasons why we don't have folks getting screened perhaps as early as we would like, or even folks being compliant with cancer treatment, is that there is this gap sometimes around information. And so one of the things that we've committed to doing as an organization is to working with these organizations to help raise awareness, to share information and educate the community on cancer prevention and risk reduction, and then to do whatever it is that we can to increase health literacy levels around all diseases that we know are disproportionately impacting the African American community. And I'm using the African American community as an example, but I think that also extends to other diverse and multicultural populations.
Mm-hmm. So I whizzed through my presentation, but I usually talk about the difference between cancer disparities and cancer health disparities. So a cancer disparity can be a difference in cancer rates, who gets cancer, who survives cancer, who dies from cancer for any reason. It can be biology, it can be gender, it can be any reason. But a cancer health disparity is a specific difference due to what? Some of the social mess, the structural barriers, social, economic, and political, and those are causing differential rates. So, for example, if you got a genetic predisposition, some people have the breast cancer gene, and if a policy insurance policy doesn't allow you to be covered because you have that gene, or you have to pay a higher premium, you've created a health disparity. So that's the difference. It's a disparity due to the social stuff, the social things that we put in place, and we can change it as a society. So these social determinants of health can be positive mediators, some people call it, or barriers. And so, what excites me about the research that we see is how creatively people are tackling some of those issues in their communities. So, an example, access to care. In COVID, we've seen it. You've seen lots of examples of the issues to access to care. I used to live and work in a rural area. There wasn't a cancer center there. There was a small community hospital. You had to get over a big bridge, 17-mile bridge, to get to the big hospital. People didn't have the money to get over that big bridge. So what happened? They delayed care. But what's the solution? Telemedicine. We've seen that with in COVID, how first that wasn't really paid for or pushed, and now there's a push for increasing telemedicine as an alternative, and actually home care as well. That's another thing that we saw, is folks couldn't get to cancer treatment, so how can we bring the treatment to them? So we've got folks who are testing models of bringing that cancer care in the home. So those are just some examples.
And the only thing I would add, and kind of picking up up where Dr. Daniels left off from a policies perspective is not looking at these things as sort of individual incidents, but rather looking at it as more of a complex issue. And when we talk about access to care, it's not about just whether someone can, has the ability to get health insurance to get the coverage that they need, but do they actually have the means to get to a facility that might be located on the other side of the city. An example that we just did with ACS CAN in our Medicaid Covers Us project is really doing a deep dive into Tulsa and sort of the health disparities that were left behind by the race massacre that took place a century ago. And when you sort of look at where the access to care issues lie, a lot of it is as this was referred to it by our Tulsa individuals who spoke on that issue. It's across the tracks. They have to take buses and other modes of transportation just to get to treatment. Whereas if all the health facilities are located on this one area of town, then that presents another disparity and other issues that individuals have to face. And so I think it's kind of looking at it as sort of a complex, it's definitely a complex issue, and there are bits and pieces that we can focus on, and kind of looking at the COVID example with telehealth. Telehealth is an amazing tool that we can now use, but we also have to make sure that folks have broadband access so that they can access telehealth. And I know there's other forms of telehealth as well, but that's just making sure that everyone has a equal playing field, if you will.
Thank you everyone for your comments. Great, excellent. I was fortunate enough to watch that presentation too, and personally, I know people who weren't Black, who weren't of color, who didn't know much about the race massacre until a couple of years ago when it became popular from a TV show called The Watchmen, to be brutally honest. And now we can see that we're historically showing the reality of disparities, and we could correlate it from this event and showing through time how it plays out today. So I thought that presentation was excellent. There's a question David Becker put in the chat. Let's try to answer that. His question was, with the alarming cost of cancer and 75% of all cancer patients impacted by cancer-related financial toxicity, is ACS working to impact this specific challenge for their patients? This often shows up as food insecurities, housing, and other basic needs.
I'm sure Lance has something to say about that. We have several research projects in that area that are already funded, that is related to that. And so one of the research projects that recently was finished was the investigator collaborated with a nonprofit, a medical legal cooperative. So they were using patient navigation, and they were comparing regular navigation with this enhanced navigation that partnered with some legal nonprofits. So the legal nonprofits help with, how do you get your bill paid? How do you stop evictions? All of those financial things. How do you can't pay for the care? How do you either work out a plan or you find some way to cover the care? There's folks in communities that pay for care, but people might not know about it. For example, Georgia has, some states have a state Medicaid program. If you're diagnosed with cancer, your care is covered. But if you don't know that, you don't know to apply for it. So there's some solutions like that have come out of the research that our funded grantees have done.
And Ellie, I would just add to that, I think under the Robert Wood Johnson Foundation grant that we've received as an organization, which was just renewed, there are several projects that the health equity team has in place that address some of the social determinants of health, including food insecurity, transportation, so on and so forth. And I think, in some conversations that we've been in with potential corporate funders, this has come up because we've even seen within our Hope Lodges where we provide free lodging to patients receiving cancer treatment. There have been issues around food insecurity amongst the patients that are staying at our Hope Lodge. So it is something that our team is, as an organization, is looking at on multiple levels, both the research level, the programmatic level, so on and so forth, because you can't talk about advancing health equity without talking about addressing the systemic issues that influence those inequities.
Yeah, and just to add, I won't take too long on this one because I think the answers were definitely well sufficient. But I think making sure that folks have comprehensive coverage to health insurance coverage, and then also, as Dr. Daniels pointed out, looking at patient navigation programs that can actually help walk individuals through what's covered and what's not, and help them have a better understanding so that they can advocate better for their health. Because what we don't want to have happen is, especially in states where individuals don't have access to comprehensive health insurance or on a short-term limited duration type plan that's not adequate for cancer care, is for them to have to sit there and make a decision. Do I pay my rent this month, or do I go get this cancer screening, or do I go get this treatment that I know I need? And then they ended up putting it off, and that ends up snowballing into other issues as well.
Well, we have no more questions in the chat, and I'm sure because the presentation answered probably so many. So I am greatly appreciative of your all's time for coming out and presenting. It was amazing. I appreciate all the guests for attending. And once again, for an action step, I'd ask for people to check out the link that was put in earlier. If you want to get involved or figure out how you can get involved, please click on the link. Advocacy is huge for us, supporting our research initiatives. Also, there's also career opportunities within a diversity, equity, inclusion place as well, moving forward. And lastly, we have employee engagement groups. You may have ERGs or resource groups in your own organization that you can get involved with to help kind of push the initiative forward. And so on behalf of ACS, American Cancer Society, I want to say thank you for your time and have a great day.
Thank you.
Thanks, everyone.
Thank you. Thanks, everyone.